Thank you so much, Trevor. And now, many of you here today represent organisations committed to ending what we refer to as neglected tropical diseases, or NTDs. Those diseases that are felt most acutely in resource-limited parts of the world where access to preventative medicine and effective therapies is hard to secure. And just as we've heard from Trevor there, climate change is indisputably making it harder to control and eliminate those diseases. So changing rainfall patterns, rising temperatures, and extreme weather events are increasing the incidence and range of vector-borne disease and complicating efforts to combat and eliminate NTDs. Our next moderator is Priy Kanayson, who is a public health policy and advocacy specialist with extensive experience in global health and development, and she is currently with the Global Institute for Disease Elimination, or GLIDE. She is here to present our next panel, Climate Threats to Malaria and NTD Control and Elimination Programs, Progress at Risk. Ladies and gentlemen, please welcome Priy to the stage.
Thank you very much, Sally, inviting my fellow panel members to join me and take their seats. And thank you all for being so awake and engaged after lunch. We very much appreciate it. So as Sally said, my name is Priy Kanayson. I lead advocacy and communications at the Global Institute for Disease Elimination, or GLIDE, based here in Abu Dhabi. And GLIDE is a relatively young institute founded in 2019 at the Reaching the Last Mile Forum here in Abu Dhabi, and is very much the result of a long-standing partnership between His Highness Sheikh Mohammed bin Zayed Al Nahyan, President of the UAE, and the Bill and Melinda Gates Foundation. And we are focused on elimination, as our name might suggest. Very much right now on 4 infectious diseases of poverty: malaria, polio, lymphatic filariasis, and onchocerciasis, or river blindness. And we work across 3 pillars, looking at elevating awareness and engagement, advancing elimination strategies, and fostering and scaling innovation, all through partnership, country ownership, very much looking at catalytic solutions that will lead to long-term sustainability for that last mile. For GLIDE, an institute focused on disease elimination, we know that climate will impact our goal of disease elimination, whether it's for malaria, NTDs, or polio, and indeed across a whole slew of diseases. And so for us, we seek to become a climate literate institute in the region. I think we can still say we are likely one of the only health institutes in the region. Please correct me if I'm wrong, but I think we still are. And we very much look to build capacity within the region and the next generation of public health specialists, global health specialists, as well as elevating the voices of those in endemic countries in the fight towards elimination. So, as we heard Trevor say and our other panelists this morning, we know that climate change can and will aggravate over half of all known human pathogenic diseases. We know it's going to undermine the achievement of universal health coverage. There is a high-level meeting at the United Nations coming up this September on UHC, and we know it's going to disrupt the healthcare systems that are already fragile and not resourced to respond. It will, as we know, widen health inequalities within and between populations, and very much threaten to undo the last 50 years of progress in development and poverty reduction. And when we look to disease elimination, that's something that's incredibly ambitious, and that hope of elimination, of eradication, of wiping a disease off the face of the planet. To date, smallpox is the only one human disease that we have wiped off the face of the planet. Guinea worm or polio could be next, but as we know, that last mile is incredibly challenging. When we look to malaria, NTDs, polio, we've seen how extreme weather events have impacted these burden of diseases. Most recently last year with the devastating floods in Pakistan, Niger, this past weekend with the cyclone in Malawi, and even looking to other so-called high-income developed countries, my home state of California had snow in the Los Angeles mountains over the past few months, which was unheard of. From my parents' house, I could see it. So you have all of these extremes, and start thinking about where we're going to start seeing these climate-impacted infectious diseases. So for us, we're really excited to be here today to talk with our panelists. And I will note that you will notice in the program we were going to be joined by Dr. Corinne Karema, who's the interim CEO of the RBM Partnership to End Malaria, but unfortunately she couldn't join us. However, Mr. Hendricks very kindly offered to step in, and we're really excited to hear his perspective from Malawi Ministry of Health. So I wanted to acknowledge that we have had a change in the program. And so we'll look to our panelists today to talk a little bit about their perspectives and their experiences as we look to the threat posed by climate on achievement of elimination and eradication. So, Mr. Hendricks, I'll turn to you first. You are the focal point for human health and climate change within the Ministry of Health in Malawi. And I just want to reflect on that for a moment, because I don't know that there are very many ministries of health that have a focal point on that intersection between health and climate. And so I think that's incredibly innovative and forward-looking. So could you tell us a little bit more about this and the ministry's approach to considering climate and health interventions?
Thank you very much for giving me this opportunity. As the moderator indicated, I'm Hendricks Mgodie, working with Ministry of Health in Malawi, and I'm indeed the focal person for human health and climate change in the ministry. That is since 2014. I've been overseeing human health and climate change in the ministry. And so far, the main focus, according to the agenda, is on the climate-sensitive diseases. Our ministry is focusing on climate-sensitive diseases. Now, to narrow to it, I'll talk about malaria, what Malawi is doing about malaria intervention and elimination, as well as about the neglected tropical diseases, including the schistosomiasis. Furthermore, also talk about the soil-transmitted hemathic and the LOF, which Malawi is championing. I'm here to inform the member that in Malawi, we've got a robust program on the malaria and the NTDs, which is championing to reduce the occurrence and the prevalence of these diseases. Actually, I have to share with the member that before 2014, our Ministry of Health did not champion any issues to do with human health and climate change. But due to the inception of some projects of the Global Framework for Climate Change in the ministry in 2014, then I managed to be the first focal person in the Ministry of Health to champion human health and climate change in the ministry, and we have managed to mainstream issues to do with human health and climate change in the government sector program, documents and policy document across the country. And not only that, we have made quite a lot of interaction at country level with the Environmental Affairs Department, whereby Ministry of Health is part and parcel of the committee, on the steering committee for climate change in general. And we have also have some indication in what we call the NDCs, whereby health sector has been a priority sector in the NDC for Malawi on human health and climate change. Just to add on that, furthermore, that in terms of the country position paper for Malawi, every year when there's COP, in my case, I've attended COP in Madrid, in Glasgow, and finally in Egypt. Every year, as a country prepares what you call the position paper. And that position paper, human health and climate change, is being prioritized as a country priority, just because of issues which I've been championing. Now, let me talk of what, as a country, as a ministry, we have done on the malaria, as well as the NTDs and the other, like the LOF. Some of the strategies which we are championing in Malawi, let me talk about like malaria. We're scaling up what you call the insecticide residual spray for the selected households in our country to reduce the prevalence of the mosquito bites in our country. To add on that one, we're also distributing what you call the mass distribution of the long-lasting insecticide nets every 3 years to the poor rural community in our country. And currently from 2020, we have also initiated what you call mass drug vaccination for the anti-malarial vaccine in our country for the age group of 5 months to 22 months. We have also intensified what you call the mass screening on malaria cases for the patients. Well, about other, like the schistosomiasis and other neglected diseases, we have done what you call the mass drug administration. For instance, for schistosomiasis, we do administer what you call the praziquantel, the albendazole, that's for deworming to the mass community. That's almost every year. We do also conduct what you call advocacy and awareness campaigns to the community. We also support what you call, we have supported what you call operational research on documentation, evidence to guide innovation approaches to Malawi NTDs and the soil-transmitted mythic program interventions across the country. Our emphasis mainly of the national program is to reduce the prevalence and the prevalence of the vector-borne diseases in our country, namely malaria, NTDs, LOF, and schistosomiasis. That is what our nation was advocating. Now, as a Ministry of Health, why as a ministry there? As I've indicated already that human health and climate change now is a priority in the health sector. And currently, as a ministry, we have established what we call the Health and Climate Change Core Team, which is overseeing issues to do with human health and climate change across the country, and it is a MAT sectoral membership whereby we've got academia, research, government institution, media, a faith-based organization, and environmentalist in this committee, which we meet quarterly to discuss issues to do with human health and climate change in Malawi. I think with these few words, I think the moderator, I have to stop. Thank you.
Thank you very much. I think you sort of answered the next question I was going to ask you, which was, what can other countries in the region learn? I mean, it sounds like you have this multi-sectoral quarterly meeting of health and climate change core team that meets. Could you maybe expand a little bit on some of the considerations that that team might take into account when thinking about MDA, so mass drug administration, or screenings or vaccination campaigns due to climate-related events such as flooding or cyclones or things like this?
Yeah, okay, thank you very much. As I indicated earlier on that this is a multi-sectoral group composed of different expertise from different membership. Actually, the core task for this is to guide the country on issues to do with human health and climate change. For instance, we do what we every year we come up with for the annual contingency plan for the emergency and preparedness plan for our country. Like currently, our country, we have been experiencing cholera outbreaks since last year, February. We're in the 15th month with the cholera outbreak. And unfortunately, as I'm talking here, from Sunday up to today, we have been hit by Cyclone Freddy, and with the latest news that we have almost encountered more than 100 deaths. And mainly from 100 deaths, almost 85 deaths are from Blantyre Commercial City. So the committee mainly, once we meet, they give advice and direction on issues to do with human health and climate change and policy guidance. One, secondly, they also encourage, because these members are from different organizations which are implementing climate change in general in the country. So they make recommendations on how to proceed with how to achieve intervention on climate change in terms of emergencies, in terms of cholera outbreak, in terms of climate-sensitive disease, in terms of early warning and alert response systems, in terms of data management on meteorological data linked to climate-sensitive disease, healthy data. All this is being done by the multi-sectoral committee. Thank you.
Great, thank you very much. And I think we'll have a session either later today or tomorrow on early warning and response. It sounds like there's a lot that we can all learn from how Malawi is currently responding and preparing for the greater sort of impact of climate-sensitive diseases. Thank you. I'd like to turn to Joelle, who's the Director of External Affairs at DNDi, or Drugs for Neglected Diseases Initiative. And looking at what DNDi does, could you tell us a little bit more about that and the quest for treatments and drugs to respond to these climate-sensitive diseases that we've heard about from Hendricks?
Thank you, Priya. The Drugs for Neglected Disease Initiative is a product development partnership. It initiates and drives drug development for neglected diseases. And in fact, it was established by 4 institutions from low and middle income countries: Kenya's KEMRI, Fiocruz from Brazil, the ICMR in India, and the Ministry of Health in Malaysia, in partnership with Médecins Sans Frontières, the Pasteur Institute, and the WHO. It was established after Médecins Sans Frontières award of the Nobel Prize gave the opportunity for MSF to signal that there were very visible crises, humanitarian crises around war and major disasters, but there were invisible crises, and one of them was the neglected diseases, including neglected tropical diseases. So DNDi has developed 12 treatments over the years, including 7 for neglected tropical diseases and 2 for malaria, which then were handed over to another organization, another product development partnership that is called Medicine for Malaria Venture. And if you want to think about who drives innovation for a response with, or biomedical innovation for climate-sensitive disease, you need to think of DNDi and MMV. And in practice, I think that Trevor has illustrated how climate change is really interacting with the ever-presence of NTDs. We just heard a testimony of how important it is for Malawi and many other countries, particularly in the tropical zone, to actually focus on this. But the truth is that it actually is characterized by 2 major factors. One, there is a climate change impact we just heard of, with very significant consequences in terms of the, the patterns of vector presence and geographic spread of the vector, which then leads to the disease expansion, possibly in novel areas with patients that have not been exposed yet to the pathogens. And maybe the best example of that, and the other characteristic is that the NTDs are often already diseases of the poorest, of the most remote or most impoverished communities, and thus even further neglected. What we are seeing with the combination is that, for example, dengue, which was mentioned earlier, is the most prevalent mosquito-based, mosquito-transmitted viral disease. It has increased by 2 the number of cases in 10 years, so doubled. And some studies suggest that it will affect 60% of the world population by 2080. In fact, it has sprung out of very specific endemic regions to being present all over the world. Another example is leishmania, less known than dengue, but actually carried by sandflies, also affected by the weather patterns that are affecting their ecosystem. And therefore, we're seeing leishmaniasis now in areas where there was no leishmaniasis before. 600 million people are at risk, and some have suggested that it would double by 2080. So these are kind of real example of populations affected by neglected tropical diseases, but the characteristic also is that they are so neglected that they are inadequate treatments. In fact, those 2 examples are great. Dengue, there is no treatment. And for leishmaniasis, it illustrates all the other situations of treatment for NTDs. You either have drugs that are toxic, expensive, long treatment, very cumbersome, some requiring treatments in hospital with complex infusion and long hospital stay, which are prohibitive for the often poor communities affected or the very resource-constrained health systems. So here is a situation which is an explosive situation, because on one hand we have no treatment, which means no incentive to go further expand access to treatment and reach the population, reduce the incidence of the disease. And on the other hand, we have climate change, changing the geography of the vector habitats and multiplying the risk. And for me, that's kind of maybe a summary of why I'm making the plea here that innovation for climate-sensitive disease is actually an intricate, a very, how do you say, consubstantive to climate change adaptation. And I really hope that the COP later this year in UAE will actually include this agenda.
Thank you, Joelle. And I think that leads really nicely into the next question I have for you, and the slide is up, to talk a little bit about the opportunities and the hurdles on the way to leverage this innovation that you spoke of in the pharmaceutical industry for climate adaptation, considering this is one of the many steps on the way to COP.
Yeah, thank you. Well, first, before I introduce this slide, which is my doomsday slide, the looming crisis, I just want to say there are some positive things, right? So there's progress in treating NTDs. There's been a real mobilization for mass drug administration. 781 million people treated a year is not an insignificant number. We have 47 countries that have already eliminated an NTD. So there is really kind of some, still, it's a little bit of sunshine in the picture. There's also progress in technology. We're now not only search for potential molecules in pharmaceutical libraries, but we're also working with AI, and in fact, most recently, DeepMind, the subsidiary of Google and Alphabet, to actually identify potential treatments for neglected tropical diseases. There are, in many ways, some really positive news. There's also some really, challenging developments. The UK withdrawal from supporting NTD treatment has been quite a shock to the community. There's also a lack of data, and I hear for the colleagues who were speaking earlier, a real appeal to really not limit yourself to malaria, but to really go and try to actually instigate the development of data. We have diseases for which we don't even know the epidemiology, but in fact, quite a few NTDs are often diagnosed as malaria, and because of the lack of data. But I would say that the most looming crisis is the one I wanted to portray here, and I left a slide for your consideration because I think it's really a moment for us to realize this. What we have on the left side is the impact of climate change. We talked about the vector-borne and waterborne infectious diseases, particularly NTDs and malaria. We talked about the new emerging disease, zoonotic disease, less today, but when we talked about One Health, we were hinting at the fact that this is not alien, this is part of this entire climate change ecosystem. And then the last component that's often not talked about is climate-related migration, how the population migration is actually contributing to the spread of diseases and often very fragile communities. In front of that, with what I mentioned earlier, it's very clear that we need to invest in new drugs for neglected tropical diseases and malaria. But the truth is, we learned a real lesson with COVID, which is whatever we dreamt of having changed in the global health system in the last 20 years, we didn't change. We're still having an ecosystem that develops drug for the wealthy and does not make those drugs, or doesn't even design them originally, for the most vulnerable communities around the world. So I think this is a kind of a warning. We think that there is an ecosystem failure, that the global biomedical innovation system is not responsive to the needs of low resource setting. And that's actually a policy failure, because much of that is actually subsidized with extensive private funding and public funding. And there is an opportunity for public funding and public policies to actually change this. And if we can change this in the coming years, we will not only only change the future response of future COVIDs, but also change the face of drug development so that not only PDPs like DNDi and MMV provide the crutch to that system, that failing system, and develop new drugs, but we'll have a much more massive engagement of all pharmaceutical innovation forces engaged. The last point is that we need to be realizing that this is again a crisis that has an inequity driver. It was mentioned earlier that low and middle income countries are on the front line of climate change. They are the one bearing the brunt of the crisis. And what we know already is that where will the most impact of, for example, dengue will be in the coming 10 years. It will not be in New York City. It will not be in London. It will be in most of those countries who are no power to change the ecosystem for innovation. So it's a call for action, and therefore, second pitch, it needs to be discussed at COP at the end of the year.
So we'll put a pin in that and come back to that and make sure that we're all advocating for this. And just to say, we will have a Q&A session at the end. I know my mind's firing off with a lot of questions right now, but we want to afford the audience the same opportunity. And I like that you highlight that point around climate-related migration. I think that's an incredibly important one to consider when we think around inequities and the trends that we're seeing around the world of countries looking inward versus outward, and the collective action that's needed. And that need to recognize that diseases and the impacts of climate change have no borders. We saw this with COVID. We are very well aware of this, but we have to consider that as we prepare and adapt as well. But I'm also glad you talked about progress, to know that we have made progress, that it's not all doom and gloom. And one country where we've seen progress is Vietnam. And so I'd like to turn to Mr. Do Trung here, who's the head of parasitology department at the Vietnam National Institute of Malariology, Parasitology, and Entomology. So could you please tell us a little bit about some of Vietnam's experience and progress in eliminating lymphatic filariasis and malaria, especially the considerations of the impacts of climate change?
Yes. Thank you very much. For I'm going to thank you, organizer, to invite me attend this meeting and talk about the elimination of lymphatic filariasis and malaria in Vietnam. As you know, Vietnam is identified as one of the 5 countries that are most severely affected by climate change. Climate change has made users infected on structure of disease, especially communicable disease, including lymphatic filariasis and malaria. And the changing of environment, temperature, and rainfall affected to transmitted of malaria. They are closely related and affect on growth, development, biology, ecology, and transmission of malaria and many other vector-borne diseases. In present to climate change, in order to achieve the goals of malaria elimination, Vietnam has developed a national strategy with a number of ready and proactive solutions and interventions, including the first one, ensuring all the people has access to early diagnosis and effective treatment of malaria at the public and private health facilities. Conducting the active and passive case detection and treatment at both public and private sector. Providing support for patients following up to ensure the treatment compliance. Ensure supply for case detection and drug available in various facilities and communities. The second one, ensure the coverage of all people addicted to malaria by appropriate malaria control measures. We provide the bed net and hammock nest to people addicted to malaria. We focus on ethnic minority and mobile migrant population. Conduct indoor residual spacing and malaria forces. Carry out the entomologist surveillance to identify the distribution and behavior the changing of malaria vector and monitoring the insecticide resistant vector. And the third one, changing malaria surveillance system. In Vietnam, the own malaria case reported within 40 hours through the online system. we conduct the case investigate for all the malaria case and all the FOSI are investigated and classified. All active FOSI response within 7 days of detection. We regularly use the map of the disease distribution, carry out the malaria risk stratification, vector distribution, develop the ability of disease transmitting mosquito that integrate with many environment and climate change. Actively monitors indigenous and imported malaria case. We developed the annual distribution map of malaria transmitting mosquito density according to variation of rainfall, temperature, and humidity. We developed the system for monitoring, surveillance, and evaluation of malaria control program from center to community level. We developed the process and guidelines for monitoring, surveillance, and evaluation of malaria prevention programs for extent level. About the achievement and lesson from Vietnam, for lymphatic filariasis, we researched on the criteria of elimination of LF by WHO, and we got a certificate for elimination of lymphatic filariasis in Vietnam in 2018 already. And for malaria, quite a scale of malaria intervention have led to majority reduced in over malaria mortality and morbidities over the last decades in Vietnam. And in 2022, a total 455 malaria cases reported in the whole country with a population nearly 100 million people. And currently, Vietnam is on track of malaria elimination roadmap. And by 2022, in Vietnam, 42 out of the 63 province has been certificate of malaria free now. And with national in the past, in order to reach a goal of elimination of malaria by 2013, the following element and intervention should be ensured. The first one, strong political commitment of the government and local authorities with the domestic and extended funding from malaria control and elimination is secured. Ensuring the own people at risk malaria has assessed effective and qualities assured anti-malaria drug. The third one, to maintain the high coverage of insecticide-treated net for the people at risk of malaria, provide the hand net and mosquito repest nets for mobile migrant population and forest growth. And the fourth, improvement of malaria surveillance system through the capacity buildings and provides an appropriate tool and guidance. Multi-sector collaboration include in health and non-health sector. And strengthening cross-border collaboration with other countries in the region for sharing and transferring the good practice and for strengthening technical and management expertise in malaria elimination. The last one, to maintain a recent surveillance system and case management at the own level to prevent re-establish malaria in areas where malaria already is eliminated. Okay, thank you.
Thank you. I think that was very good to follow Joelle's, because we heard a little bit about some progress in what Vietnam has been doing, and I think that importance of monitoring and surveillance so that you have the continued understanding and that real-time data to understand what's happening and be ready to respond. So could you tell us a little bit around how you then evaluate that control and eliminations of specifically malaria over the past few years and how it compares to what other countries in the region are doing?
Yes. Vietnam has made excellent progress towards elimination of malaria in recent years, but we have still some work to do. Vietnam is one sick country in the World Health Organization Mekong Malaria Elimination Program, and Mekong sub-region has Sintunagis denies in malaria case globally in this year. Between 2015 and 2021, the Great Mekong subregion reduces the number of malaria cases by 77%. But in Vietnam, we reduce more than that, about 86% reduce the case malaria. And in 2021, we have 467 malaria cases. And 2022, we have only 450 cases for malaria. And there are two main drivers of the progress. Over 30 years, Vietnam efforts the fight malaria have had strong political leadership. In the early 1990s, the National Malaria Control and Prevention Programs was established, which has from Minister of Health, and active involvement for political leaders from all the provinces in Vietnam. And in addition, government has invested and significantly among the money in malaria prevention and control, and have made range progress in moving the Vietnam close to elimination. With the support of government, especially the agency as Minister of Health, as an impact in our city, have carried out the transnational project, policy advocacy, communication, support technical assistance on surveillance, and strengthen activity and active method to fight the disease. And Vietnam has developed a unified monitoring and reporting system from central to local level that is very effective for malaria control. And Vietnam has also carried out the synchronously, consistently, and effectively activities for diagnosis and treatment and vector control and communication in malaria prevention and elimination. However, our students' work tells that the pocket of malaria still exists in Vietnam in some hard to reach or high risk area, such as forest, mine, or plantation. This is where the government and the partners should be doing in the efforts. Okay, thank you.
Thank you. There is something you and Hendricks both mentioned in the course of your talks, and before I turn it over to the audience for any questions, to just ask, you've both mentioned the importance of political leadership, and we've seen in the Malawi Ministry of Health and from 2014 having a focal point on human health and climate, and the importance as well in Vietnam of having that local buy-in at the local level of government all the way up to the highest level. Could you both maybe share some insights onto how communities are involved, so the people and those patients at the end there who are very much the ones experiencing the impact on their daily lives of the impacts of climate to their health and well-being? And are there avenues in your countries and these various commissions and programs to have community advocacy or the community voice involved? Hendricks.
Thank you very much. I'll talk about experience from Malawi. In Malawi, we have developed what we call the community health advisories. These are community health advisory on extreme weather events. They are in different languages, English and multiple local languages for Malawi, and they're being disseminated or advertised in the newspapers to alert the community on how to adapt when they're encountering any extreme weather event. That's one. That's community engagement. Secondly, we have also managed, as a Ministry of Health, to come up with what you call human health and climate change training manual for the community in the local languages. So that's one way of community engagement. Further to that, in our country, we've got what we call our community local radios. And this in community local radios, we do make broadcasting issues to do with human health and climate change in our local language so that our community can have an access and knowledge on climate change and health. And finally, we're also using what we call the indigenous knowledge from the local community which is very important, combined with the scientific knowledge in addressing impacts of health and human climate change in our country. Thank you.
Thank you, Hendricks. A lot to learn there, a lot of gems that I've been noting down. And what about you from Vietnam's perspective and the community engagement?
Yes, in Vietnam, when we conduct the control or prevention on disease, first one, the need the own level, not the central level, province level, and district, even the commune level. They should know about the disease and the affected disease for human. And after that, they can do something, or they can issue some document to invite some sector to involve the control activity. After that, they issue, they ask some people, local people, to conduct the activity. I think that's when the people understand about the disease and how they know about how they do so for control or prevention activity, they can involve it. It's easier. Yes.
Great. Thank you. So it sounds like there's this consultative process, there's advocacy training, capacity building, and ensuring that the people themselves are understanding the impacts of climate and exposure to these infectious diseases, but then also sharing their own experiences and concerns to inform the policies that are happening.
Yeah.
Joelle, just one more question to you before we turn to the audience. When thinking around sort of ahead to COP28, I think, what would you want to see when we're thinking around innovations in drug development for these neglected diseases, and what would be sort of your call to action?
So just a word on community engagement first.
Yes.
Interestingly, even in drug development, it has to start with that. Otherwise, we don't necessarily develop the right product for the right circumstances. And it's very critical that the target product profile be designed with good understanding and good engagement with communities onto, okay, well, what are the hurdles they're encountering? What are the characteristics that a drug should be? And I hope that that spirit can also be in the COP process, which is communities ultimately bearing the brunt of the climate change and its intersection with health will be active participants. But in addition to wanting to have the community focus at the COP, I think that the urgency for me would be to try to first, I think we can count on the UAE to actually bring health as a centerpiece of the climate agenda, and not just NCDs, but infectious disease. We just overcame the COVID crisis, and I think we need to keep that future in mind. And hopefully we will touch on the issues I mentioned, which is have the right prioritization of the diseases of the most vulnerable, the most impoverished communities, and those who are at the front of the climate change agenda.
Great. Thank you. And I think we have time for maybe one or two questions. If there's anyone from the, there's a lady right here in the front and one in the back, I see. If there's a mic, we could run to them. Right here.
Yeah. Hello. My name is Ekwa Adade. I'm a PhD student at Brunel University, London. My research is on examining the impact of climate change on malaria. And my focus is in Ghana. So based on the progress you've made in Vietnam, and Malawi, I just want to find out, mostly malaria, the effect, causes and everything is being focused around socio-economic issues. And now we are talking about climate change and malaria. Is it timely to single out climate change and malaria and look at just the direct impact without considering, well, there's been researchers that consider a lot of socio-economic issues, but looking at the progress being made, is it the need to kind of shine the light basically just on climate change and malaria and look at the direct impact, the linear impact, and be able to focus intervention on climate mitigation and adaptation and malaria?
Thank you. Anyone like to take that first?
I can take it.
Go ahead.
I'll talk about Malawi on that one, especially I indicated earlier on that there is need to have a link between the meteorological data and the health data so that you have an evidence on that one that indeed these climate-sensitive diseases, for instance, like malaria, is directly linked due to the impact of climate change, but with inadequate or limited data which links mate data and the health data to build a case that there's a direct link of malaria, then we'll have a generalization of the routine thing that malaria is endemic. How do you link it to the increase this year? Is it due to climate change? What about the past 10 years? What is the proof? So we need to go in that direction to link climate data to health data and build a case that indeed the surge or the increase of cases in malaria is due to impact of climate change. Thank you.
Thank you. I think in the interest of time, we'll pass back. There is a lady right in the, if you want to raise your hand again so Jenny can see you. And I think, you know, my malaria colleagues in the room would probably say, no, we can't be laser focused on one issue because there's a danger in global health of hopping from one hot topic to the next. And just because climate now is the hot topic doesn't mean that everything else is suddenly off to the side. We have interventions that we know work, but we have to think about what will get us to the last mile, as well as considering the current challenges and future challenges. Go ahead, please.
Sorry. Can you hear me?
Yes.
Despite the mask, yes?
Yes, absolutely.
Okay, great. I'm Silvia Ferrazzi from MMV, Medicines for Malaria Venture. Thank you very much for this panel. It was very informative. And I have maybe a couple of points in terms of, additional point in terms of risk to progress on which I could appreciate the feedback from the panelists. One is about seasonality. So one risk is actually with the change of seasons that we heard also about, which we heard also this morning. Actually, there are a risk of not being able anymore to target the populations with the right tools because the season changes. They are becoming either longer or they start later or they end later. And so the question is really in terms of how we address this risk, which probably requires a very catalytic connection between climate data, the capacity to adapt our tools, so a change in the medicines, as this is what we are trying to do also in terms of seasonal malaria chemoprevention in Medicines for Malaria Venture, and also the impact of this tool, so actually how we capacitate the communities to use the adapted tools. The second point is on disasters, climate-induced disasters. And here the problem is that I suppose it has not been discussed in the panel, but it's also about the global supply of medicines, correct? Because we are struggling in malaria and certainly in NTDs as well in terms of ensuring a global supplies of the needed medicines for poverty-related and neglected tropical diseases. And actually, we are trying now with local production partnership to improve the situation, but with increased demand, the global capacity will become less and less sufficient. And we need really to develop innovative partnerships in order to continue to engage the manufacturers to help in pre-positioning for preparedness and response, the global supply capacity to the countries that are actually addressing the challenge of malaria elimination, like Veitnam and other countries in the regions and other countries that are much far away from actually malaria elimination. This is true for malaria, but I'm sure that in NTDs this resonates as well. Thanks.
Thank you. So I'll turn to my panel and invite, actually, I'll start with you, Do, and then we'll come down this way if anyone would like to respond to those final questions. And then in the interest of time, I have a big red 0 flashing at me. We'll invite you to also leave your final sort of call to action or remarks for our audience today.
Yeah, I think that's climate change affect malaria concerns in Vietnam. They almost infect two mosquito. And so we need, we have some more activity for mosquito control, we take the map of mosquito, and we also take some activity for controls of chemical to attack to mosquito, and we also increase some activity for surveillance mosquito for malaria. So I think that's with some activity focus on mosquito transmitted malaria, we can take something to reduce malaria.
Thank you.
Okay. That's all.
Great. Joelle, any final thoughts?
Thank you. I mean, thank you for raising those issues. A colleague from MMV, I think the global supply of medicine is a real preoccupation. Well, malaria is one disease, NTDs are 20 diseases. Half of them don't have drugs, treatments, so there's no issue of supply there. It's about innovation. The rest are real acute issues of manufacturing, including the fragmentation of the markets, different issues that, of course, need to be addressed. So I guess to your question, Priya, about what needs to be, hopefully, the next step from this, I hope that we can track the progress of the COP conversations and see, one, this agenda here being at the forefront of the COP discussions, which they haven't so much been in the past. And we look forward to the UAE leadership in this account. And included in that is a real focus on the most vulnerable, on the populations that are kind of least able to actually drive both innovation and access scale up at the moment, because they have been neglected or are too impoverished to drive that agenda.
Thank you, Joelle. Hendricks, your final thoughts?
Thank you very much. My take-home words are, one, we need to increase political will, advocacy, determination, and patriotism, and the recognition of the health sector as one of the sector which is impacted negatively by climate change. Second, also we need to convince the high-level authorities, policymakers, decision makers, to establish the position of climate change and human health as a substantive position in the Ministry of Health to champion issues to do with humanitarian climate change. Thirdly, there is need to mobilize or to find ways how to access global as well as domestic funding on climate change and human health in our different countries. The fourth one is on the COP26 Health Initiative, on the commitments which were made in Glasgow on the resilience of water system and sustainable low carbon emission. That was in 2021. It's high time now we need to put this commitment into action before the COP28, so that we should showcase the fruits of the commitment which were made in Glasgow. Number 5 is also there's needed to establish a robust, functioning, and active core team or committee championing human health and climate change at national level. And finally, there is need to support operational research, documentation, and evidence to guide innovative approaches to climate-sensitive diseases. Thank you.
Thank you very much, Hendricks, and thank you to the panel. I think I'll just end by saying that we could have kept talking about this for quite some time. I think we know very much that there will be climate impacts on our efforts for malaria and NTD and other infectious disease control. On your final point around operational research, GLIDE, my own institute, launched a climate edit of our Falcon Awards for disease elimination to identify 10 small-scale projects where we're doing formative research on the intersection between climate and infectious disease. And I think we need to add, as you said, Hendricks, to the body of knowledge and evidence between those links so that we can plan better and have evidence-informed discussions. So we look forward to continuing the conversation today, tomorrow, and over the next year. And thank you all very much.